So tummy pain is a very common condition in children. Many things can cause tummy pain. The vast majority of it is because of viral flu, where they got upper tract infection with the virus, and when they swallow the sputum, it goes into the abdomen and can cause a bit of tummy upset, tummy pain, a bit of diarrhea. For those symptoms and those associated problems, simple paracetamol would do, and the pain should usually subside by itself. Other conditions such as constipation is also very common in children. Parents can buy simple laxative from the pharmacy to try to see whether the child will open his bowels. Also introduce more fiber and fluid to their diet so that their bowel opening is more regular. Other conditions that can cause tummy pain, which are more serious due to surgical conditions such as appendicitis, intestines that are blocked, or problem with kidney stones, problem with kidney obstruction, urinary tract infections. Those conditions need to be treated slightly differently and usually at a hospital setting by a pediatric surgeon. So you need to identify what the common causes are, and if something that you can treat with simple paracetamol at home and the child is well hydrated, then you do not have to worry too much. The child should get better by himself. But if the child has got other symptoms, not feeding, not drinking enough, and persistent pain, even with simple analgesia, then it's best to visit your GP so that the GP then assess and refer the child on if he or she thinks the child has got more significant problems that need to be addressed by a pediatric surgeon. So at different ages, there are different conditions that may present to the pediatric surgeon. The common one where it affects any age group is appendicitis. So usually a pediatric surgeon will request for some blood tests and some ultrasound scan to check whether there's any signs of appendicitis. And secondly, to look for other specific conditions in children, for example, something called intussusception, where there's telescoping of intestine, usually the small intestine going into the large intestine on the right side, causing significant pain. Other conditions such as swelling of the glands in the tummy, which is something called mesenteric adenitis, is something that is difficult to differentiate from appendicitis, and often the surgeon will admit the child for observation to see if the pain settles. As opposed to appendicitis, which the pain does not settle and gets worse, mesenteric adenitis usually gets better with hydration and pain management. Other conditions in the abdomen, such as abnormalities of the bile tract or kidney, or any problems in the intestine, such as something called 𝐏𝐚𝐢𝐳 diverticulum, can also cause pain in the abdomen. So we also look at the testicles, which are extended organs from the abdomen, which is actually descended into the scrotum. So sometimes pain in the scrotum, pain in the testes can cause what we call referred pain in the abdomen. So the testes needs to be examined and checked so that there's no problem to the testes, which is causing referred pain to the tummy. So if the child requires surgery, for example, for appendicitis, then the choice of surgery is laparoscopic, which is small, tiny cuts in the tummy to remove the appendix, which causes significantly less pain for the child and faster recovery and earlier discharge from hospital. As with other surgeries in the abdomen, I usually perform most surgical procedures in the abdomen by the laparoscopic method.